We've been concerned for provider safety in the wake of the West Webster attack on firefighters back in 2012. So we hosted a 4-hour seminar on scene size up and situational awareness and cover and concealment. We had some professionals from law enforcement come in and talk to our personnel about the things to do when you get on scene there. We even had some defensive tactics instructors come in from the police departments, local police academies, to demonstrate some defensive tactics. But as an educator, I knew that what they were getting from the lectures was important, but without that psychomotor component of how to actually defend yourself, they were missing out on an important part of being safe on scene. So after some research, we looked into the DT4EMS EVE course, and we brought it to our administrative staff, and we cautiously embraced the idea. I think for us, we didn't want our providers to take a course that made them aggressive or turned them into fighters. And our concern was for our patients, and certainly liability was a concern in that respect. What happens when we have to put our hands on a patient? And that's probably the concern of most administrators of any health organization is, we have to now put our hands on a patient. So we spent 5 days with Brett Piney from DT4EMS. He came in and did the instructor course for us, and I will tell you that our eyes were opened to many things. Assaults on providers are more prevalent than any of us had guessed. About 52% of providers nationally have reported being assaulted. We did an in-house poll of about 25% of our providers, and 90% of those people indicated they had been assaulted at some point in their EMS careers. We learned a lot about those assaults and about the long-term and short-term effects on providers who are victims. In most cases, the long-term psychological drawbacks are much worse than the actual bruises and breaks themselves. Having to come in every day on the job and then be scared because of something that's happened to you in the past, it can ruin your career even if you aren't seriously injured. I think, at least for me, the 5-day instructor class really showed how to wrap scene safety together neatly with a reasonable use of force. There's a great focus in EVE on avoiding use of force whenever possible, but when use of force is unavoidable and we're being attacked, how do we use that force reasonably? What is our best chance to defend ourselves in court if we find ourselves the victims of an attack and we have to use force to escape from that attack? Learning about the legal aspects of the use of force in the class with the focus on that term reasonable really allayed some of our liability concerns. That, along with the emphasis on not on beating the attacker per se, but in simply refusing to lose and using force only to escape and get off scene and get to a safe area, really makes the EVE course very appropriate for what we're doing. We're not looking to be martial arts fighters. We're not looking to beat somebody up. We're just trying to defend ourselves and escape and get away, in whatever way we can that's reasonable. We've trained over 50 people thus far, and the feedback has been great. People are enjoying the course. Our goal, I think, down the road would be to have all of the EMS and fire providers in our region get this training. I think it's important. We are facing violent people occasionally. We go to scenes that we believe are safe, and we get there and find out that they're not. And to give our people and empower them with the ability to defend themselves and to understand when a patient is no longer a patient, has now become an attacker, and how to get ourselves to safety, I think is invaluable to keeping our people safe and to the overall well-being of our providers.